Africa is a continent of extraordinary diversity, vibrant cultures, and untapped potential, yet it faces a harsh reality. Life expectancy here is the lowest in the world. This stark contrast raises three pressing questions. Why do so many lives end prematurely? What drives Africa's low life expectancy, and how can this issue be effectively addressed? From challenges such as limited access to healthcare and persistent threats such as poverty, infectious diseases, malnutrition, and the impacts of climate change, we delve into hypotheses proposed by experts and organizations, including the United Nations, African Union, and African Development Bank. Coupled with our own investigative findings, we seek to uncover the root causes preventing millions of Africans from living full, healthy lives and to shed light on potential pathways for change. Additionally, we investigate how investing in life expectancy in Africa could drive economic growth while also helping to address global security challenges related to war, terrorism, climate change, human trafficking, drug trade, and polarized global development. The current average life expectancy for Africa in 2024 is 64.157 years of age, a 0.27% increase from 2023, when the average life expectancy was 63,8428 years from birth to death. In the future, Africa's average life expectancy is projected to increase to 74,8811 years of age by the year 2100. The total increase of the average life expectancy for people living in Africa by 16.97% from today's standard. This positive trend can be attributed to technological advancements, a better standard of living, and an increase in healthcare availability.
It is widely believed that poverty shapes life expectancy in Africa. So is this true? The answer is undeniably yes. Poverty significantly drives life expectancy through multiple interconnected factors that affect health, access to services, and quality of life.
In our analysis of different reports, data from various sources, and a comparison of African countries with selected countries having the highest life expectancy such as Japan, Finland, and Switzerland, we note how poverty impacts life expectancy in the following ways. 1. Inadequate sanitation and housing. Poverty is strongly linked to poor living conditions such as overcrowded and unsanitary housing, which promote the spread of infectious diseases like cholera and malaria, reducing life expectancy. 2. Poor nutrition. Limited financial resources restrict access to nutritious food, leading to malnutrition. This weakens the immune system and increases vulnerability to disease, further lowering life expectancy. 3. Limited access to healthcare and prevalence of infectious diseases. Poverty often limits access to quality healthcare, making it difficult for individuals to receive timely medical treatment, which leads to higher mortality rates from preventable diseases. Poverty also exacerbates the spread of diseases like HIV/AIDS, tuberculosis, and malaria, particularly in regions with scarce resources for prevention and treatment. 4. Environmental factors. In poverty-stricken areas, exposure to environmental hazards such as polluted water sources, contaminated air, and inadequate waste management services lead to chronic health problems, further reducing life expectancy. 5. Education deficits. Lower levels of education in impoverished communities contribute to a lack of awareness about health practices, including disease prevention, proper nutrition, and the importance of seeking medical care, which negatively impacts life expectancy. Statistical evidence demonstrates a strong correlation between poverty and life expectancy in Africa. 1. Over 40% of the population in Sub-Saharan Africa lives below the international poverty line of $2.15 a day. 2. The average life expectancy in Sub-Saharan Africa is approximately 64 years compared to a global average of 73 years. 3. Sub-Saharan Africa records 52 deaths per 1,000 live births compared to 3 in high-income countries. 4. The maternal mortality ratio in Sub-Saharan Africa is 555 per 100,000 live births, significantly higher than the global average of 211. 5. Approximately 20% of children under 5 in Sub-Saharan Africa suffer from stunting due to chronic malnutrition. 6. Malnutrition contributes to nearly 45% of deaths among children under 5, significantly reducing average life expectancy. 7. Sub-Saharan Africa accounts for 67% of the global HIV/AIDS cases, with 25.6 million people living with the disease. Life expectancy in regions heavily affected by HIV/AIDS can be 1020 years shorter than in less affected areas. 8. Africa accounts for 94% of global malaria cases, with 96% of malaria deaths occurring on the continent. 9. In Sub-Saharan Africa, 60% of adults have not completed primary education. 10. 1 year increase in education increased life expectancy by 1.7 years. 11. Over 400 million people in Sub-Saharan Africa lack access to safe drinking water. 12. Only 28% of the population has access to improved sanitation facilities, contributing to high rates of waterborne diseases. In our investigations, particularly on the issue of undernourishment, we conducted further analysis by comparing the common daily meals in African countries with those from well-renowned countries for their rich and diverse cuisines, such as Japan, France, China. This comparison revealed striking differences. 1. Limited dietary diversity in African countries such as Malawi, Zambia, and Zimbabwe. Daily meals often consist of nsima, a maize-based porridge, or its equivalent sadza in Zimbabwe, and nchima in Zambia, served with a simple vegetable relish, which frequently lacks protein and variety. In stark contrast, Japanese meals commonly include rice, fish miso soup, and a variety of pickled or fresh vegetables, offering a well-balanced and nutrient-rich diet. 2. Nutritional gaps in countries such as Nigeria, Ghana, and the Democratic Republic of Congo. Iron deficiency is prevalent due to diets dominated by cassava, yams, and other starchy staples, which are low in iron and other essential micronutrients. Conversely, French cuisine often features fortified bread, dairy products, and meats, which provide a rich source of vitamins and minerals such as calcium and iron, thereby preventing nutritional deficiencies. 3. Cultural and economic constraints in Ethiopia and Eritrea. Economic limitations often result in many people relying on injera, fermented flatbread made from teff, typically served with lentils or chickpeas. Due to the high cost of meat, it is not a regular part of the diet for many, leading to protein and nutrient deficiencies. By contrast, in China, even economically modest households incorporate affordable protein sources such as tofu, eggs, or pork into meals, along with a variety of vegetables. This helps to ensure a more balanced and nutrient-rich diet, improving overall nutrition and health. 4. Role of traditional practices. Traditional cooking methods in African countries, such as prolonged boiling of vegetables in Ghana, Nigeria, and Kenya, often lead to significant nutrient losses, particularly of vitamin C. In contrast, Japanese culinary practices emphasize steaming vegetables or consuming raw foods such as sashimi, which helps to retain essential nutrients and enhances the health benefits of meals. 5. Health outcomes. The nutritional challenges faced by African countries are reflected in health outcomes, with high rates of restricting and wasting observed in countries such as Kenya, Ethiopia, and Uganda, where diets often lack sufficient protein and energy. On the other hand, Japan boasts some of the highest life expectancies globally, largely attributed to its nutrient-rich, low-fat diet, which emphasizes fish, rice, and vegetables, contributing to better health outcomes and longevity. Although common meals in Africa are unique with a rich array of flavors, locally sourced ingredients, and cultural significance, they often lack sufficient variety in micronutrients and balanced nutritional composition. As a result, there is a need to supplement meals with food supplements, which help address deficiencies in essential vitamins and minerals such as iron, vitamin A, zinc, and iodine. These supplements prevent malnutrition, support immune function, improve cognitive development, and reduce the incidence of micronutrient-related health issues, particularly in vulnerable groups like children, pregnant women, and the elderly. However, they are cost-prohibitive, increasing the economic burden on families and healthcare systems. Additionally, using them for widespread and long-term interventions is not sustainable, as it could lead to dependency on external aid and potentially result in long-term health consequences such as poor dietary habits or micronutrient imbalances if not carefully managed. In summary, the low life expectancy in Africa is largely due to a combination of factors, including poor access to healthcare, high rates of infectious diseases, malnutrition, limited access to clean water and sanitation, and socioeconomic challenges. Additionally, climate change exacerbates food insecurity, water scarcity, and health risks, further undermining public health. Political instability and terrorism also play a significant role by disrupting healthcare systems, displacing communities, and impeding development efforts. Addressing these challenges requires comprehensive strategies that improve healthcare access, mitigate the impacts of climate change, promote peace and stability, reduce poverty, enhance nutrition, and tackle preventable diseases, ultimately improving life expectancy across the continent.
This documentary has been produced to raise awareness among vulnerable communities about major, yet often rare, waterborne diseases. The goal is to inform the public about the risks, prevention strategies, and the importance of safe water practices. It has been created by the Center for Earth and Natural Resource Sciences, CENS, in collaboration with Save the Surrounding Environment and Biodiversity, SREB.